Libero Addy. Val, thank you.
Thank you, Mr Davies, and as ever, it's a pleasure to serve under your chairmanship. I'm going to start by obviously congratulating the member for Elmet and Rothwell on his fantastic opening and his continuing advocacy on this issue. It's so important. For myself as a member of the APPG on endometriosis and as someone that lives with endometriosis, I'm always really pleased when it makes it onto the parliamentary agenda and actually gives members an opportunity to discuss the policy changes that need to be introduced. But we've heard that the first time that it was discussed was 21 years ago and not enough progress has been made. During the last debate that we had on endometriosis and PCOS, I took the time to share my own experience and the difficulty that I and others have daily and just the general process of going through diagnosis and treatment, because it's not in any way easy. The symptoms go from physical to mental and it can ruin every single day. And during the last debate, members will recall and have been reminded again already that it's taking up to 8 years in the UK for the average woman to get diagnosed. And I would like to remind members and ask them to consider what that actually means for those that live with it every single day. That's 8 years potentially of living in excruciating pain, waiting for a GP to diagnose the cause of your pain, being gaslighted by the GP and other health professionals whilst you continuously ask about your pain. And that pain is so severe that it can prevent you from carrying out everyday activities, and it can be incredibly disruptive to work. When I shared my experiences the last time, I didn't actually have the time to talk about how I dealt with my pain at work, because during the time when my endometriosis became quite bad and I started to look for a diagnosis, I actually worked here as a parliamentary assistant. And without a diagnosis, what other people are generally finding that they actually have nothing to show their employer to explain why they need time off, and when their symptoms are really bad, nothing to point to give them a legitimate request in their employer's eyes for flexible working. Now, I haven't had necessarily many advantages, but I had... I'll give way.
Thank the Honourable Lady for giving way and congratulate her on the comments that she's making, and also my honourable friend for bringing the debate today in such a powerful manner. The Honourable Lady speaks with some personal experience in this matter, and she talks about the working in this place and working with an employer who is undoubtedly sympathetic and supportive. Could she help explain to the Minister, and helping him to come to some conclusions about what he can do to address the problems raised in this debate, about what her employer did that will actually make a difference for other employers, and what the department can do to address the problem?
Absolutely, and I thank the Honourable Member for his very well-timed intervention, because I was just about to get to that. I was very fortunate in that my employer did not even have to wait for me to request flexible working measures. She thrust them upon me. My employer was the Right Honourable Member for Hackney North and Stoke Newington. As soon as I experienced the issue where I had to go to hospital at one point in time, she came back, and when I explained to her that they were looking towards a endometriosis diagnosis, she began reading up on it. She sent me links almost every day. She understood and allowed me to come into work later in a day because I was having quite bad evenings. She would shout at me if I was doing too much. It's the only time she would shout at me, just so that you know. And she gave me an entire month off after my botched laparoscopy, and after my botched laparoscopy, she threatened to go to the hospital and tell the doctors about themselves. Now, we're not asking for people to be that extreme in their necessarily flexible working arrangements and making allowances for their employees, but there are experiences where people can be very good to you. And then in becoming a Member of Parliament, I remember I spoke to our accommodation whip, who's the member for Allen and Deeside. At first, I was told that the way to get an office that was suitable, or a better office, was to perhaps be very nice to him. I spent my time complimenting his ties, I eventually got to explaining to him what my issue was, not in so much detail, but he understood immediately, didn't ask too many questions, and he gave me the type of office I needed that would make it easier for me to get around Parliament. These are examples of things that you can do to support women with endometriosis, and this is why mainly we urgently need to bring down waiting times, because going through measures like this can be very, very difficult, but not just waiting times in terms of diagnosis, but follow-up. It's all well and good to diagnose a woman with endometriosis, but if she's not followed up with further treatment after a laparoscopy, it continues, because endometriosis does grow back. All those living with endometriosis need to be able to, once they're diagnosed, understand for themselves what they're experiencing, also be able to talk to their employers about their condition, and employers need to take the time to be informed about said condition. But it doesn't end there, because we know there's actually no cure for endometriosis. The only treatment that they have at the moment may be able to ease painful periods, etc. And we know just how much it impacts people at work. And I think it's worth mentioning the endometriosis APPG report again, because I think that 55% of people with the condition having to take time off work is not a small thing. And 27% saying they missed out on promotions because of it is not a small thing. And this is an issue that women already face in the workplace overall. And 40% worrying that, that they're going to lose out on their jobs and further studies. And 1 in 6 actually having to give up their work, all because we're not taking care when we need to. Now, we urgently need to support those with endometriosis in the workplace so that it doesn't affect their career advancement or overall. And I think to myself that I had to consider quite often whether, at the time when I was thinking about becoming a Member of Parliament, whether I actually could. Whether I actually could, because I was in so much pain, whether I would be able to campaign in the way that you're meant to and do all the things that you're meant to. And I don't think that's fair. It's not fair for any woman. It's hard enough for women in this place in the first place and in many other workplaces right across the country. But to be able to have to be in that situation where you have to think whether or not you should continue in a job or go for a job that you would love simply because of your condition, simply because it's not being given the level of importance that it deserves in terms of policy, is not fair at all. And there are several steps that I believe the government can take to sort this, and that has to start with clarifying whether or not endometriosis is covered by the Equality Act. Now, we have to be very clear. I mean, I'm going to say what the Equality Act states. It says a person has a disability if they have a physical or mental impairment which has a substantial and long-term adverse effect on her ability to carry out normal day-to-day activities. So if endometriosis prevents an individual from carrying out their day-to-day task, and I promise you it absolutely does, then it should be entitled to the same protection under the Equality Act that diabetes currently has. And we now know that endometriosis affects as many women as diabetes does. And further clarity on this would go a long way towards ensuring that those with endometriosis are not discriminated against in the workplace. Along with this, I join campaigners calling on this government to adopt an open culture when it comes to discussing menstrual health. For far too long, women have been made to feel ashamed or embarrassed when discussing their bodies. I know, for example, when I was at school, you had various names for it. People would say their cousin had come to stay, that the Red River was flowing. All of these really weird things. You pass sanitary towels under the table. It's all meant to be shame and embarrassment when it comes to our periods. And I believe that further to this, the government has to work with the NHS to ensure that people with endometriosis have the right access and support at the time they need when it comes to time off work. And just to end, sorry, because I know I'm going on a bit longer than I should have, it's really, really important. I think now is a good time to pay tribute to all of the endo warriors and the many different organisations and the blogs, because there are women like myself who would not have been able to cope if they hadn't had all of this information from other women. But it shouldn't have to be like that, because we are not in ourselves always medical professionals. But I wouldn't have been able to do what I needed to do to be able to physically campaign and put myself forward to stand in this house if I didn't read all of the things that were out there online, and most of those were provided by other women. So very grateful to them, but the government really does have to step up to the plate. Thank you.